Hello, friends. A very good morning to all of you out there, and a very, very warm welcome from the entire team of RFA tutors, your mentor this side. I hope everybody's doing great. Thank you so much for joining in. Is my voice audible and clear to all of you out there? Hello. Hi, Seema. Good to see you here, my dear. Hello. Hi, Sadaf. I know at work, sweetie, but thank you very much for joining in. Alia, thank you so much for joining in, my dear. Warm welcome to all of you. Amar, good to have you here. Thank you very much. A very warm welcome. Wanted to start with the energies, wanted to start with lots of guidance. I know that till date, college has still not announced the date. We are not sure when the exam is, but definitely it is in May. We are still waiting for all the venue details as well, but it's absolutely okay. I'm sure that this time would be enough, like your shining stars for November 2025. Of course, we are waiting for the February exam. Beautiful scores. So many students above 80% were there. So many students, they scored the distinction rather than just passing. And I'm sure that you guys would be one of them. It is tough to take the first step, but it's absolutely doable. The only thing needed is a direct, focused approach, knowing that what exactly is needed for the exam, how the scorecard of exam, and you all would do it great. Now we are heading towards today for this one, which is the May exam, and I'm meeting you to have the introduction greet for the same. This exam in May, still we don't know to be communicated the date. Mrcpi, Osce, that is in Ireland. And this is something which you should be knowing about that is going to be an international center. Few of the students, they have emailed and they got the Oman as response, but still, we didn't have the website update yet. Whatever you're choosing, may that be Ireland. If you're living in UK, if you are in Ireland, definitely I suggest the Ireland Centre. But if you are in overseas, if you're in the Gulf region, GCC, or you feel that your traveling is easy to Oman, you can take the center as well. We are going to have the opening dates in February. As soon as the college announces the venue, we are going to have our confirmation and we are going to begin with the February date of registration, where I want you to register as early as possible. The ones who were in the February course and they didn't get the seat, definitely they are going to be on preference than those who are applying for the first time. Please keep a note here, ladies and gentlemen, that the exam fee varies as per the center. For the international center, because of the traveling and certain administrative additional concerns, this is a higher fee structure as compared to Ireland. And May is the exam. June is going to be the result. Wishing for a successful result in June 2026. Thank you so much. May I know any queries about the center, about the booking, any queries regarding the having the selection of what venue you're going to choose? How many of you are aiming for Ireland? Of course, those who are living in Ireland, I do understand all the Irish students are going to take the same. Moreover, the ones who are practicing in Ireland, that makes sense that you're going to take it, even for London. Seema, yeah. So from UK, traveling to Ireland is comparatively easier rather than coming back to Oman. I do understand that. Yeah. But as soon as the update is there, we would definitely inform you. If any questions are there, you all can unmute or you can write in the chat, and I'm happy to take. Sadif, you would be taking Oman Center, am I right? Sadif, Oman, Amr, you guys would be planning. Zoya would be in Ireland. Nasreen,
Me also in Ireland, ma'am.
yes, exactly. You should be taking because in UK. Amr, you were saying something.
Yeah.
So I don't have a preference, so can I just apply for both to increase my chances?
No, actually, the application suggests you and allows you to do one selection of the venue. So you can't apply
Okay, in
for.
this case, I will be applying for Oman.
You will be applying for Oman. Yeah, I do agree. I do understand. Asma Zubair says Oman, inshallah. That's fine. That's fine. So Oman mock exam is going to be with 1 day gap before, I mean, a gap of 24 hours, and before that in mock exam. You all are already in the mock group. So my suggestion would be just taking it as a final throttle. The ones who do not know about the paper pattern, of course, the ones who are shifting from the February to this course, they do know. But I will just tell you that OSCE pattern, Ireland, Southern will stay with my uncle beforehand. He's in Birmingham, and then from there I'll go. That's also good. I understand. And Ireland year because I take Ireland and then I travel to Oman because of you guys insisting for. But actually, we are not sure about the data. As soon as it's announced, definitely in the study group, we're going to have a discussion and the plan and all the bookings. All right. So part two OSCE, it's an objective structured clinical examination like any other OSCE. There are 7 stations, 10 minutes each. They give you a 1 rest station. So 8 stations, 1 is rest station, the rest 7 stations are there. These stations are made that you're able to solve a scenario, you're able to have a communication, you're able to pick up with the investigation, and generally out of all the OSCE, 1 is the simulated patient task, rest of them are the examiner discussion. Okay, all right. This is for the circuit. For the circuit, all of you, what happens is, for example, this is the complete circuit. 1, 2, 3, 4, 5, 6, 7, 8. 8 stations. Out of them, 1 is going to be the rest station. Out of them, 1 is going to be with the patient talk. Rest, all of them are going to be examiner discussion, structure discussion. So 6 are with the examiner, we call them as structure discussion. 1 is going to be with the patient, we call it as ASPT, and plus 1 is a rest station for you to breathe and to get ready for the next. Now it's absolutely your luck that you start with the rest station and then you have 7 continuous, or the rest station comes in the middle. You start with an SPT and rest are structure discussion, or how it goes, because all the candidates in one group are going to be 8. 8 will go to 1, 1 will go to 2, 2 will go to 3, 3 will go to 4, 4 to 5, 5 to 6, 6 to 7. Do you guys get it? So all would be moving. You can start from a rest station, you can end from a rest station can be in the middle. This is how it goes. Am I clear? All of you, did you guys get it, right? This is the idea behind the preparation, that you guys have a taste. And the mock exam is going to mimic it absolutely, so that you guys have the same idea. One more thing, please. You don't have any reading time. It is 10 minutes only presentation time, and your reading is part of it. Clear? Your reading is part of it. So you do not have any sort of an rest in between in terms of reading separately. Did you guys get it? All of you? You're not going to have any sort of a in between rest for the same. I hope I'm clear. You guys get that? So it is that you have to read in the same presenting time. Now, this is one part of your exam. The other part of your exam is long case. In 2026 February now, long case were in the morning, 3 hours break, and then the circuit. Long case is one only, Amar, either obstetrics or gynac. So we don't have 2 long cases. All right, 1 long case only. So first student obs, gynae, obs, gynae, obs, gynae, obs, gynae, so they just divide it that way. Quite doable long cases had been there, but I'm changing a little pattern because multiple things in one long case they are giving, So when you'll attend the course, you'll understand how I'm changing the strategy for that. Now, the long case, since the COVID, does not have a real patient. Before that, it was real patient. You had to do the examination. You have to find out the findings and all. So you guys are lucky. Whatever the case is, that is a mannequin or that is a role play. So the findings are going to be given by them only. You guys get it? The findings are going to be given by them. What you have to do is that how the examination is done. They're going to see your steps of the examination. However, you might find a mannequin with the cyst. I mean, a ball can be there. Sometimes a tennis ball is there. So in Ireland, whenever I do the mock exam, because it's in a collaboration with the university, so they have all the teaching mannequins where you get like fibroids in the bimanual examination. You get to know that, okay, how do we understand that if it's a cyst on the right side? How is the tenderness elicited? How is the smear taken? How are the Lupot maneuvers done for the obstetrics? All these questions, they are expected by the examiner that you know them. And then when you come back to the seat, they help you in giving you the examination so that the long case proceeds further, right? So I repeat once again, this is the total exam on the screen in front of you guys, right? This is the total exam. That is a circuit station. They're going to be 6 plus 1, and long case, they are going to be either OBS and either gynae. That's it. Am I clear about the paper pattern? If yes, then we'll go to the preparation.
Hi,
Did
ma'am. Good morning.
Yes, Nasreen, good morning. Please, my dear. I'm here to
Interesting.
take the questions for the pattern. Yes, Nasreen, my dearest.
Yes, the first thing is this Oman confirm it? يعني it's still in the system TB.
So I have 2 emails, Nasreen, and these 2
Uh-huh.
emails are by students who have asked and they received the answer that it's in
Okay.
Oman. However, on the website, it's not uploaded.
Okay, thank you. The other thing, if the examiner will give me the finding about long case, even if if there is real patient,
Sorry, what with the patient?
and if they not malatal, there is a real patient, and I examine the
No.
patient.
No,
They,
there are no real patients. There's going to be only mannequin, a model there
on,
to. No, you don't
okay,
touch them. You don't touch any human being in the exam.
okay, I understand. Thank you.
Only mannequin would be there. The history taking would be from the role play. Okay? Clear? Okay. Any other question for the exam pattern? Anything in your mind? Which I want all of you to be clear today so that when we start the preparation, you guys exactly know that in which direction. Alia, can we get a lesson on the clinical examination questions required in the Ireland system? Absolutely. For Ireland and for Oman, for both, we would have in the long cases a separate sort of steps that what is needed. Okay. And I will enlist them for you guys as well. All right. And they're uploaded on your website as well. They exactly know that smear should be known, speculum examination should be known, internal vaginal examination. More than welcome, my dear Alia Shaw. Now, all the recent 20, yes, my dear Sony, please.
Yeah, because if I
Yes,
want to
please.
take, like, if I want to tell my examiner, yes, that for general examination, for vital sign examination, shall I do all it? Like from up to down, general examination, for jaundice, for anemia. Shall I
Generally,
do
the
all
examiner
or only tell?
Generally, the examiner gives you a command, my dear, like perform the obstetric examination. So you have to perform that examination. The examiner gives you a command that please perform the speculum examination. General examination, you guys should know, but not coming up in the long cases because vitals check, blood pressure check, respiratory check. They don't generally count it into the obstetrics. I mean, they've got a lot to test you, right? So they generally give it to you guys. I mean, this finding is given to you guys rather
Okay.
than just going ahead.
That
Yeah.
means maybe
Okay.
specific examination they wanted.
Specific, absolutely specific examination. They're going to tell you about that this is what you guys are going to do. Right? Okay. All
Thank you,
right.
Doctor.
Most welcome, my dear. Okay. Now with this, you guys, okay, Alia has a question. Alia, yes, my dear.
Sorry, Dr. Asadra. Good morning and thank you for your help. There is any station for the instruments like forceps, vacuum, and extra?
100%. Now, in the circuit, what happens is that they always give one hands-on, right? They always give simulation in which you have to practice the station in terms of having the hand maneuvers, for example, shoulder dystocia, right? They would give you something which is the cord prolapse, emergency can be there. They can give you the station like forceps, vacuum. All these can be there. Definitely for those, one hands-on is always must. Always must.
I mean,
Okay,
they
that
will
comes
ask
up in
about the
exam.
details of the types of the forceps, types of the names, and the curve, the short, the long, and or just
When forceps
full
comes,
stop.
then everything should be clear to you guys. When
Okay.
forceps comes in exam, then everything should be clear to you guys. You know, that comes up in exam. All right. Okay. Okay. Now, it's not about only forceps, friends. It is about all the hands-on that should be done. For example, to an extent that in the mock exam, I do the knot tying as well. You know, why? Because I tell them that it's very important that you guys exactly know that what is the situation in terms of if an odd one out comes. Like you should be able to see in Levin Burns, you should be able to see the Wrigley's, you should be able to see all the type. You should be able to have the vacuum application, the Ventus. This is something the college expects. They can give you a hands-on station with all the emergencies. Shoulder dystocia is a very important one. So everything, neonatal resuscitation, Alia, that's a very important one.
Yeah.
College loves asking about the neonatal resuscitation. These, how do you put the C and the E grip? All these things we teach, and that is one station always in the circuit. So you should, when you do the sessions, you'll understand and you'll have a grip over them. Okay?
What about the sutures types, Dr. Sadra? They will ask
Sutures
about
type,
sutures
they
type.
don't come up in exam, but they can be part of one's surgical skills. For example, hysterectomy comes, abdominal hysterectomy, vaginal hysterectomy comes. I always tell you guys that laparoscopy steps should be known to you guys. Hysteroscopy procedure should be known to you guys. Cystoscopy is a very, very old 2016, 2017 exam station, but it can come. You should be ready for all the minimally invasive surgeries. This time also in February, we had the laparoscopy steps for the ectopic pregnancy, right? So knowing about the content is must so that if anything comes, even if it's a smaller version or if it's a bigger part, we are able to manage that. One more thing, please. Every time the new stations are coming from the recent guideline, 2023, 2024, 2025 guidelines are very important. Male subfertility, because the subfertility is a new guideline, so we're getting the subfertility stations. Do you guys get it? All right. So make sure that you're very clear regarding whatever content we have. We actually have a grip over the guidelines. Why? Because 6 of the stations are with your examiner. So if you know your recommendation, what are the Irish recommendations? You guys are very, very strong in your applied clinical knowledge. How to pass Mrcpi Osce is a very targeted approach, a very targeted approach. Knowing the content is so important. Knowing the guidelines is so important. Knowing module wise things are so important. And this is how we're going to take a start. The regular, the premium course would start with the basics, would start with making your basis very, very strong. We will do early pregnancy, we will do antenatal care, we will do maternal medicine, we will do all the important stations related. You will have the long cases, you will have the OSCE circuits, a total number being discussed around 100 stations. And let me tell you guys that the exam is doable with this preparation. The only thing I need is that from now start speaking because we have got already less time to get ready for May. Still, it's doable, but now because we are taking a start, I think my aim and my expectation from all of you is that the module which we have ended, before we start the next module, that's on your tips. Okay? I don't want things to have a backlog because if it's a backlog, then of course you guys have pressure before exam because when I'll be starting the fast track, I want that the regular is already known to you guys. Tips for the circuit presentation is that for a structured discussion, I'll tell you my way that how you have to talk to the examiner, how to impress the examiner, how do you communicate to the examiner, what are those things which you say and you get better score. And for the simulated patient task, How do you enter into the cubicle? How do you address concerns for the patient? How do you acknowledge? How your eye contact, how your posture, how your hand movements, all these things that impress the examiner. How you have to sit forward and how you have to be empathetic when it comes to the breaking bad news or a challenging situation. How you're going to negotiate, keeping the respect and dignity of the patient in mind. All these things would come with the circuit presentation. Students, they often ask me that how much time or how much do we have in terms of, how many stations can we fail in exam to pass the exam? So generally, out of the stations, 1 out of 7, you have an, permissibility to fail. I would not say that you take it easy. I mean, we should go with 7 by 7. But if 1 out of 7 goes failing, you still have a passing circuit. And we have to pass the circuit, Amar, and pass the long case both separately. All right. Okay. A very important thing that you guys need to understand is that circuit has got no contribution to long case and long case has got no contribution to circuit. If any of this fails, no matter, I've seen students scoring 75% but still not making the exam because one of the content was failing. So overall, your percentage can be higher than passing, but if one of them is failing, unfortunately, you don't pass this exam. Is this point clear? This is a very, very important point. If you fail in 2 out of 7 stations, the circuit is failing. And no matter the long case is passing, exam is failing. Do you all get it? Is this point clear to you guys? Yeah? Okay. Very important to know
Yes.
this. Yes, Sony, very important to know this because I don't want anything to be taken easy for you guys. I mean, you should be clear that whatever we are doing it from the start in a way that you are clear. Okay? All right. So far, any questions for the preparation point of view, from the discussion point of view, not understanding anything in the paper pattern or the circuit, please let me know. Alia, you had few questions, yeah?
Please, ma'am, I have one question.
Please, my
Yes, because I don't know if you discussed this point or not, but I
please.
want to know how the mock exams will going on. You will give any candidate different questions than the other, or it will be like a real exam and fixed question for all of us?
So everybody will get multiple different circuits and all the stations would be different from each other. Right? So what you're going to do when you are doing the mock exam, you would be knowing that what is your group, where are you presenting, and we would be knowing about the details about your presentation group. So your stations would be different than your friend. And in the end, you get the results and the keys for everything because what I want is that you have a final, complete theory to prepare. Right? You have one
At
active
the end, sorry,
presentation
ma'am, at the end,
of
you will discuss with us the other cases that I
all
didn't.
of them would be given to you. Yes. All of them would
Okay.
be given to you. The long cases also, we try to do around 20, 30 long cases, depending upon the importance. And then you present one, but you get all of them. So that at least you have theory to revise and the examiner's key to revise. Okay.
Okay. Thank you.
Long case, both of them should be on your tips, the obstetrics and gynec. And if I be very, very liberal with the numbering, guys, so it will be around, I think, 30, not more than that. So many cases are overlapping from the long case to the circuit. So it's okay. It's just that how you take your history, examination, investigation, treatment plan, and be very safe towards the patient, and you do the job. Right? You have to be very clear in your content. You have to be very clear in your sequence. You have to be very clear that you pass the long case every section. You take a beautiful, focused history. You are perfect in your examination. You are clear what investigations you're asking for. You're able to justify each and every investigation. You do the treatment appropriate as per the Irish guidelines. If it's a patient-safe approach, and you're asked to counsel and you're able to counsel the patient, you are safe in exam, right? You're absolutely safe in exam. So the ones who are still asking for the link, We are starting the Mrcpi Osce. Active participants are going to present not only in the live session, they can put their recordings daily for the moderators to answer. The listener is also available. The ones who are listener in the regular course, definitely I want them to be active in the fast track because the presentation is the key to clear. So we are starting with a module wise. Here is the schedule with you guys. Why regular course is module wise? Because I want that each and every guideline is revised. Each and every content of one module is revised and we are going to take it. Alia, that would become very easy because the questions that come from contraception are quite superficial. They don't go deep into contraception, my dear. Okay. We are going to meet on 21st of February. I will discuss the timings in the group because of Ramadan, that what are you comfortable with? So whatever timings you guys would be comfortable with, because the fast breaking time would be different in different parts of the world. So respecting these Ramadan days, we would see that what suits everyone. And then we are going to discuss the timings in the group that when do you want to meet. For each and every module, you guys have got the expected exam stations, the long cases, and your daily schedule is must. I have one statement to make, and if I say that confidently now and you take it to your preparation technique, I can write it for you today that you can clear this exam in this very time period, which is for the preparation, and that is from 10th of February, the schedule which we have posted in the group, if you follow it judiciously, there would not be a single station you will face difficulty. In the introduction now, I'm not showing the complete schedule. You all have it in the study group. But my request to all of you is, don't leave any single day. If you have left 10th, 11th, 12th, and you're not able to do that, and you're starting today, 14th of February, if you're starting today, please cover up 10, 11, 12, 13. Be smart students. This is for you guys. Nasreen, Alia,
Yes, ma'am.
Seema,
Yes,
Amar,
doctor.
don't, Sadaf, don't leave the daily schedule. You all have this till the end. I'm not going to show complete of it in the intro. You all have it in the study group. If you guys know this, you guys would see. It will be such a strong preparation that you guys will be feeling very, very
Excuse me,
strong.
ma'am. I am in Pakistan. I will come back on 18. Is it okay? Because I'm not in touch with the study.
So what you'll do is that when you come back on 18th, you will do 10, 11, 12, 13, 14, 15, 16. In first
Okay,
1
ma'am.
week to 10 days, please complete the previous one, my dear.
Inshallah,
Start
ma'am.
from
Thank you.
19th. Start from 19th and please cover up the previous one, Seema.
Okay, ma'am. Inshallah.
Got
Thank
it,
you,
my
ma'am.
dear? Okay?
Yeah.
Inshallah, my dear. All right. So if you guys want, let's do one station from the recent exam. But if you guys want to do it in the course also, I'm okay. If it's absolutely your choice that how much time. Did you guys understand that how is going to be the course schedule? How I want you to prepare? What is the exam pattern? And how much preparation is needed? Any questions regarding this? Any question regarding this? If you guys want a sample station, I can do that in introduction. But if you guys want that we do it in the paid premium group, because today is an open session, so I am absolutely comfortable. It's your choice. What do you guys want? We'll do in the premium? Or if
Can you
anybody
give
wants to
us
present.
now the just simple steps, yani? We want to just train if you can now.
Okay, perfect. All right. Okay, who would like to present then? I want a candidate. Now everybody would be like, oh my God, ma'am, what is the station, right? Let it be surprise, please. Soni, would you like to take it, Nasreen?
I want to know the session first.
What if the station, whatever is the station, Nasreen, we can do it, no problem. It's just a February 2026 new station. Can we?
I will
Come
try. Okay.
on. Oh, lovely. Can I have your camera? All right, ladies and gentlemen, we are doing a sample station from February 2026, and Nasreen is there. Proud of you, my dear. Now, no reading time separate, right? Okay, Nasreen, time starts now.
Hello, I'm Dr. Nisreen, one of exam candidate, and this is my sticker.
Thank you very much, Nasreen. I've noted your number. Please read the instructions, and once you're ready, please, I would be asking a few questions.
'Hello. 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 Okay. I read the instruction and I'm ready for discussion.
All right. Thank you very much, Nasreen. Can you please summarize your case to me?
Okay, my case is pregnant lady, 12
Mm-hmm.
weeks pregnant. She is gravida
Mm-hmm.
2, hormone, and she is known case of multiple sclerosis. Now she came
Mm-hmm.
for antenatal clinic to know more about her condition.
All right. Okay. If the patient is with you, just in the patient's language, can I have the history taking for her?
Okay, first I will greeting the patient and I will confirm her name and age. I will introduce myself and role. Then I will take from her brief history about her history of the disease when she diagnosed by this multiple sclerosis, and if she is on regular follow up with her GB, and what is the medication she is taking now. Then I will ask her if she is if her doctor know about her pregnancy, and he agreed to for her to get pregnant, and if she admitted to hospital before for any complication from this disease. Then I will take the history about her pregnancy, when her last menstrual period, and is it planned pregnancy, is it spontaneous or assist. Then I will take from her history about her antenatal visit, how the pregnancy is going so far, if she is taking folic acid, and if she is did the booking scan and test. Then I will ask her about her previous pregnancy, how the mode of delivery, and what is the outcome of her baby, and if there is any complication during her delivery, and
Mm-hmm.
I will give her plan uh, for her coming weeks of pregnancy.
Okay. All right.
I
In
will,
the
I will, sorry, but then I will complete the whole history. I will ask if there is any other medical condition, if she is has any other autoimmune disease, and if she is has any allergic to any drug or medication, and if she is on high dose folic acid 5 milligram, and if she is if there is any surgery from tummy and down below, and if
yeah.
there is any family history and concern, and if she has a stable relationship with her partner, and if he is supportive at home, and what she is doing for living. I will ask about her blood grouping, and
All
if
right.
there is
Okay,
any
Nasreen,
any blood transfusion.
can you please, can you please outline the relevant examination you need from this patient, keeping in view the history? What do you require?
Okay, I will do for her general examination. I will see her
Okay.
BMI, her vitals, her pallor, and jaundice. Then I will examine her chest and cardiac examination. I will see her abdomen to see if there is any scar or tenderness, and no need
Yeah.
for examination in her from down below.
All right. Keeping multiple sclerosis in mind, anything specifically?
Then I will see her skin if there is any skin change. I will check her joints like that.
Okay,
Then
can you please tell me the maternal and the fetal risks, please? Speak it in a way that you're counting the patient, please.
Sorry, mom, my internet interrupted. Can you repeat?
So the patient is Anne, and you have to tell her about the maternal and the fetal risk of the. Can you please tell me the maternal and fetal risks? In a patient, Anne is with you, and you have to tell that what MS in pregnancy can be.
Okay, the effect I will discuss with the patient the effect of the disease on pregnancy and the effect of pregnancy on the disease. The disease can affect mother and baby. For mother, it can be regression regression symptom of her multiple sclerosis with pregnancy, and for baby can be IUGR, and there will be high risk of miscarriage and preterm delivery, or
Mhm.
and I will check in her baby the anti-low and anti-ra. Yeah, anti-ra. I don't know.
Is it, are we confusing it with SLE?
Yes.
No
This
problem at all. You're speaking, that's a big thing for me. All right, can you please expand on the steroid use in the pregnancy? Can she use steroids and are they safe, please? Keeping multiple sclerosis in mind in this patient, please. Yeah.
is about the medication. Steroid is a friendly medication, but put mother in high risk to get gestational diabetes. So we will follow her by um, we will do for her oral glucose tolerance test at 24 weeks, and during labor we can change this steroid to injectable steroids, 2 doses during labor.
All right. Can you please comment a little about the biologics, the disease-modifying therapy for the multiple sclerosis, please?
Okay.
Are they safe? They should be changed?
Because I did it, so this case is totally new for me.
No problem at all. Tell me, do we have any genetic risk? I mean, does it run in family? Inheritable or no?
Not the multiple sclerosis, not running in family. No need for genetic screening.
All right. Okay. Can I know the postpartum breastfeeding? Is it safe for this condition? Is it safe for the medication? What would you say about that?
Okay. Breastfeeding, I think no problem with breastfeeding. Because yes, the steroid not excreted milk.
All right. Okay. Thank you. Anything you would like to add? We have 2.2 minutes, so if you want to add in something for two
About
questions
her
in the
labor
end.
and delivery, yes, about her
Yes.
antenatal clinic, it must be in high dependence unit with multidisciplinary team, including autoimmune consultant, obstetrical consultant, senior midwife, and with regular follow-up. And she will do screening for anomaly scan and screening.
You would aim for a
And
vaginal delivery or a cesarean section?
yes, her delivery also in multidisciplinary team, but the aim is vaginal delivery unless there is other indication for cesarean section, and it will be continuous
Very good.
monitoring for mother and baby, and control her pain by giving her epidural. And in the after delivery, we will handle the baby to neonatology. We will do for her active management of third stage of labor. We will encourage her for breastfeeding, and we will discuss with her the suitable contraception, and we will do for her VTE risk assessment. And also during the early pregnancy, she must take aspirin from 12 weeks. And VTE risk assessment must be done in 28 weeks and after delivery also.
Nasreen, what are the postpartum issues that can happen for this patient?
She can enter to she has risk to develop pulmonary embolism or DVT, or and her autoimmune situation will be deteriorated also after delivery, I think.
Okay, all right. Anything you would like to
And
comment
I
on?
will advise her also in the next pregnancy, she must do pre-conceptional counseling for her if she want to get pregnant again.
Okay, so if she asks you, doctor, shall I do the termination of pregnancy? What would you say to her? Last question. This is her concern that if I have
I will
multiple
ask her
sclerosis.
why she want to do termination of pregnancy, and I will calm her. This situation can be manageable during the pregnancy.
Nasreen, don't tell the examiner. I want you to counsel the patient about the multiple sclerosis that she wants to end it up. She's scared. What would you say to her? That she can continue, she should continue, or she should end it up? She wants to end it up because she's scared of the condition.
This is according to her wishes, and whatever her wish, we will support her. If she want to continue her pregnancy, we will be supportive, and we will do group of doctors to manage her perfectly till she delivers.
All right. Thank you so much. The time is up. I am so glad and so proud of you. Without knowing that what's coming up, you stood up and you spoke. This is the first step of success, Nasreen. Honestly,
Thank
when
you.
you break the barrier, ladies and gentlemen, when you break the barrier, when you don't have inhibition, when you're not thinking about the world and you're ready to speak, that is the first step of your success. And I'm very proud of you for rising up and just speaking in front of everyone. Thank you so much. I would say that if I was at Nasreen's place, I would have made more mistakes because, of course, suddenly the topic doesn't come in your mind, right? I mean, we are humans and we tend to have the nervousness and anxiety. And of course, speaking in front of a public is not easy, right? Very well done for that, but I have few comments to be made. I had the salt station in front of me and I was marking Nasreen side by side, but of course, I'm being very, I would say, flexible at the moment because it is not a prepared station. It was not given to the candidate and it was not something which we were expecting that, because I was not even sure that you guys want an extra station to be presented. It was just because Sony requested, I thought, okay, let's go for it. Okay. Now, one thing which you guys have to understand is that the tasks or the questions, they have to be completed. It came in February 2026, friends, the multiple sclerosis. The first question was that take a focused history. But listen to the question very carefully. If you can, no worries, Sony, my pleasure. Now, you would love Sony the way I have solved it for you guys. All of you, please pay attention. Anybody can tell me that what did I say when I asked the first question? What was my question to Nasreen and what was Nasreen's answer? Anyone? Anybody was attentive? What did I say and what did Nasreen answer? My question was, please take the history in the patient's language. Did somebody acknowledge this, that I said this? Did somebody acknowledge that I said this? But when Nasreen answered,
Yes, yes.
when Nasreen answered, she beautifully answered everything in the history, but not in the patient's language. So my key was, hello, hi, I'm going to introduce myself, confirm the name, age of the patient, take the permission of the history, and acknowledge her anxiety. So may I know the name of the patient? Anne. All right, I would say, Anne, I understand this can be worrying for you. I'll go through the things carefully and answer all your concerns today. Now, it is an examiner discussion, but the examiner wants you in certain part to do it as a patient. You have to listen to the question, not because you missed the points in history. You were beautiful, you were amazing in the history. But my key was that how you asked to the patient. Nasreen, do you get it? So always you guys have to, it's not that what's in your heart and it's in your mind. What examiner is asking you, those words are very important because that takes you towards the key. All right, okay. So you had to ask about any weakness, numbness, visual disturbance, the balance problems, the bladder and bowel changes, fatigue severity, recent infections like the waterworks infection or the chest infection. I was writing side by side. I needed these words, right? When she was speaking up, I needed these words. I would ask her regarding the vaginal bleeding, any tummy pain, any sort of a vomiting that had been excessive, if she is eating and drinking fine, any fever at all. Would also like to know about her pregnancy so far in terms of the booking visits. Would confirm from her that she has the scan to check the growth of the baby and dating scan. Also, the screening test of the pregnancy is being done for her. Would confirm the details of the multiple sclerosis, that what age did she get diagnosed, what is the type of the multiple sclerosis, like a relapsing type, the secondary progressive type, the primary progressive type, how frequently the relapse has been there, date of the last relapse. Nasreen, are you there? These details, of course, we didn't read the guidelines. They were missing, my love. But now you guys would be perfectly solving this station. The severity and the recovery. I would also like to have the evaluation for the baseline disability, the walking distance, if she needs any aids, if she has frequent falls, the visual problems in the past, the bladder bowel dysfunction, and the cognitive symptoms as well. A very important aspect is to ask about the disease-modifying therapy, the name of the medication, the dose of the medication, and the last dose she has taken. When did she stop? If any medication has been stopped by the concerned doctor, any recent change in her symptoms. Would like to know about the steroid intake. When was it taken? How long she's been taking for? Are they oral medications or are they intravenous medications for her? Would like to confirm her infection and vaccination history, what recent infections if she has had, her vaccinations been updated, also about her chickenpox immunity. Do you guys know that this is part of the Irish recommendation now, right? Would like to confirm about the tuberculosis exposure, especially if she had been taking the biologics as medication. If other medications she had been taking, like antispasmodics, neuropathic pain, antidepressants, vitamin D, and folic acid intake as well. Would confirm her previous pregnancy histories, the gestations at delivery, the mode of delivery, the complications, if there were some relapses in the postpartum period, fertility treatments if she has had, and if she had gestational diabetes and hypertension, keeping multiple sclerosis and the steroid intake in view. Would proceed further with the medical and the surgical history, the diabetes, hypertension, thyroid disease, other autoimmune diseases. The venous thromboembolism history is very important in this patient, keeping the immobilization in view, previous surgeries, and anesthetic problems. Would like to elaborate in the family history, multiple sclerosis or any neurological diseases, autoimmune diseases, or diabetes. Social history, smoking, alcohol, the drug intake, the BMI, mobility at home, driving ability, support at home, work demands, and safeguarding if it is relevant according to the history. Okay, please see my recap. I would keep every domain in mind, starting from the opening, current pregnancy, neuro symptoms, MS history, baseline function, till the red flags. And I have one question for them to ask. This is like an examiner key. Clear so far? This is the first question I've done. Seema, Arya, Amar, you're understanding how I want your approach to be. And each and every station,
Yes,
you would do
doctor.
like this with me. Okay, every station you guys will get a recap and you will do like this with me so that you guys are able to manage and speak the way I am taking pauses, the way I put some stress on certain words to impress the examiner. Now we did relevant examination. Prerequisites were missed when I was marking Nasreen. I would take the consent in the presence of a chaperone, hand hygiene, because you have to show your professional and safe practice, Nasreen. Clear? My general observation in the patient for the examination for her mobility, gait, tremor, and speech would be there. Why? Because you'll justify I need to have baseline neurological function in my patient. Would like to evaluate the blood pressure, the pulse, and the BMI because of the preeclampsia toxemic risk and steroid effects. Now, this MS part was all missed. I tried to give you a help as well, but of course, because we were not ready. So I understand if I was at your position, I would not even have done this much, my love. So the cranial nerves, upper limbs, lower limbs, and gait. This is the extra thing which for MS we need as per the disease, my dear. Okay, obstetric examination, the fundal height, the fetal heart rate, if it's a viable pregnancy, and peripheral edema check legs because of the mobility and VTE risk. All right, this would be my second question of examination. So am I clear about the history? Am I clear about the examination? If you speak this much, it would take your 30 seconds if you learn this. And honestly, so far, you're already on 90% scoring in your station. Are you with me? Amar, are you understanding, my dear? Soni, understand. This is my way of keeping the points in your fingertips. And the way I'm speaking, I want the same tone. I want the same confidence. And I want the same flow. Flow comes after preparing. Okay? Now, I said that I want you to counsel for the maternal and the fetal risk. Again, I was bringing from the structured discussion to the layman language to you. So again, I would acknowledge that I would say to Anne that I understand that this can be worrying, but the positive and the good news is that most women with multiple sclerosis, they can go through the pregnancy safely and deliver healthy babies. I would go through your concerns one by one. Most women with multiple sclerosis have normal pregnancies and healthy babies. It does not affect the fertility or usual cause of pregnancy complications. However, relapses often they can be, but they reduce during the pregnancy. Pregnancy does not worsen the long-term disability. The baby's risk of multiple sclerosis is only slightly increased, but we will monitor you very closely, especially after delivery, with the neurology doctor's support. Okay. Now, this one slide, which I've made, is the gist for your exam. And I want that if this comes in the May exam, you guys are above 90% scoring. Please learn what I've made is from the talk article, effect of the pregnancy, during pregnancy, in the postpartum, the maternal risks, what can be there. You should acknowledge that miscarriage is not increased, no increase in the preeclampsia, gestational diabetes, or preterm birth, but the possible issues can be urinary tract infection, VT, which beautifully Nasreen mentioned, operative delivery if weakness and fatigue is there. Labor and delivery effects, vaginal delivery is safe. MS is not an indication of cesarean section, but the assisted delivery can be there if we don't get the support of pushing from the mom. Effect on the baby, no increased risk of congenital malformation, stillbirth, or growth restriction. So this counseling should be on your tips because this would actually be needed by the examiner. I said that are the steroids safe in pregnancy? You had to say, yeah, these are safe and non-teratogenic. Nasreen, you said it's a friendly medication, and I immediately wrote here. So my suggestion is this is a term which I use in SPT, or if a structured discussion says that counsel the patient, then yes. For the examiner, you would say it's a non-teratogenic medication. Got it? I want to hear this as an examiner. Got it, my love? Yes, I'm being a little accurate in terms of tiny point, but I have to be this way because we've got 2.5, 3 months and we have to clear this exam, my dear. You will see me very different in the premium sessions. Very minute things I have to pick up so that you guys don't make this mistake. Otherwise, it becomes like a reinforcement for you guys. IV methylprednisolone can be used for acute relapse. Avoid in the first trimester because of the small risk of cleft lip. Short course considered safe. May monitor glucose if repeated courses are there. Beautifully, Nasreen mentioned about the hyperglycemia, and I loved it. Very well done. Therapy because so we were forgetting that, but it's absolutely okay. Some drugs stopped before or during pregnancy. Management individualized with a neurologist. Interferon, glatiramer may be continued, but they are not considered as safe. Monoclonal antibodies need specialist input, and the postpartum we can restart provided the pregnancy is completed and the breastfeeding safe medications are there. The background population risk, beautifully she answered about that it is not inheritable, 0.3%. The mother, if she has MS, then there's a risk of 2 to 3%, but not directly inherited, but slightly increased susceptibility. This is what the talk article says. Okay, learn these words the way I have sought. I loved Nasreen's confidence in breastfeeding. She said it's safe, and she was absolutely right. May slightly reduce the relapse risk. And some disease-modifying therapies are incompatible with the breastfeeding. But most women with MS, they have completely normal pregnancies and healthy babies. Pregnancy often improves MS symptoms temporarily, and although relapse risk is more after the delivery, it does not worsen the long-term disability, but we work closely with the neurologist to have a safe mama and safe baby. Okay, so remember that mom and baby's patient safety you have to tell to the examiner because of the MDT that has to be done. Okay, this is the summary as that of history and examination. Please see and just learn it. So what my way of solving is that first I expand on the station, guys, and after expanding on the station, I give a recap. Why I give a recap? Because those are the bullet points in the end which you have to remember before exam so that you don't miss it. Okay, the recap slides are very important slides because those help you that after expanding what to speak, what you have to remember on your fingertips. And that would help you guys. All right. Steroids for relapse, genetic risk, congenital normally breastfeeding, effects on the pregnancy and MS, on the pregnancy mother, and on the fetus as well. Learn the recap slides that would help you. I asked about the timing of the delivery. Beautifully, she told about vaginal delivery would be aimed. That was very good. Well done for aiming for vaginal delivery. Only one thing which I wanted her to speak was that operative vaginal delivery is more in the multiple sclerosis because of severe fatigue and the lower limb weakness. Okay, cesarean section is only for the obstetric indication. Very well done. You were very clear on this, Nasreen, and I was very happy on this. You mentioned epidural for analgesia. That is safe. That too was a very good approach. I wanted to reinforce about the points in the interpartum considerations that prolonged labor should be avoided because it actually causes the fatigue if it's a prolonged labor. So we have to prevent that. A good hydration, avoiding hyperthermia because it can worsen the neurological symptoms, and continuous support during labor, Nasreen did mention. Nasreen, note it down, my dear. Okay. Relapse risk is increased in the first 3 to 6 months, friends. The talk article says that it usually returns to the baseline afterwards, but the first 3 to 6 months, the relapse of the multiple sclerosis is higher. We can restart the disease-modifying therapy, which we had stopped in the antenatal time period, but with the help of neurologists, which are compatible with the breastfeeding. All right? Okay. VT risk, well done. You mentioned about this, and I was very happy that because of immobilization, there's an increased risk of that. You did mention about this. Now, this table is from the talk article, but just remember that the safety of the medications in MS were asked in the recent exam. You should be knowing about the contraindicated medications and the safe medications as well. Okay? If you remember, in the postpartum reinforcement, the restarting of disease-modified therapy depends upon patient-to-patient individualized consideration. Breastfeeding is encouraged, keeping the safety of the drugs in mind. Assess mobility and fatigue, VT risk assessment, emotional well-being, ensure strong family and social support, clear safety plan for newborn care if relapse occurs, right? We will support her in terms of fatigue, mobility, and ability to care for baby, and ensure strong family support and ensure that early physiotherapy if at all needed. Thank you so much. Am I clear? All the 7-8 questions I have managed exactly from the guideline, but the lines which are appropriate and impressive for the examiner. You have to promise me in this way, you would learn the regular, you would learn the fast track, every single thing which I'm teaching, because I am having a holistic view that what words you have to speak, what can be impressive for the examiner, how you have to see. One vision is that you have already as a baseline. And this was honestly Nasreen's baseline, and I'm proud of her. Her baseline is so strong. But tiny things in between, which I have to coach, for which you have joined, I have the responsibility to make it and polish you. And I have shown you the result in the beginning, 92%. So many, 15 students, 80%. And this is not, I think, I don't take the credit, but they exactly understand the hang of the exam. They understand the gist of the exam, what is expected from us. And you guys would see the change gradually. In February, we did not have Irish students. In your batch, there will be Irish students as well. So the competition, and of course, they're working in the practices. This is a must for the exam. They take it very, they take and practice in all these things with a very different mindset. I want you all to compete and to show that we can do it. And with this coaching, I expect you guys not only to have the passing result, to aim higher, my dear all. All right? This was the talk article, the recent exam station, multiple sclerosis of pregnancy. Everything which I've done is from the talk article, but from the perspective of Osce, that how the questions can be there, right? So if this is a situation, what can we do in this? In terms of knowing the multidisciplinary team, the antenatal care, the symptom control, the thromboprophylaxis, the relapse management, labor time and mode of delivery, the intrapartum care, analgesia, postpartum care, relapse risk, postpartum, breastfeeding, contraception, MS, and ART. If you remember these 2 slides, your final revision would be very easy. And this is what I'm going to do with each station. I will make an expanded station so you know how you have to speak. Then I will make recap of each question. And in the end, you'll get 2 slides only just to have the bullet points on your fingertips. And then that question is over. That station is 90% and above presentation skills. All right. Thank you very much for meeting me early in the morning, guys. Thank you for all your support. Any questions from the preparation point of view, from the starting point of view? So when are we meeting next for the early pregnancy? The early pregnancy, every single active participant has to be there. And those who are yet to join, who are messaging me, please, the registration is open. Make sure that you guys have signing up today. I'm here for the questions. Anything not clear? Nasreen, I want everybody to give a big round of applause to Nasreen. I'm proud of you, and I know the
Thank
hard
you,
work,
ma'am.
and thank you
Thank
very
you
much.
very much.
I'm so proud of you. Very well done, my dearest. God bless you always. I've been coaching you for so long, and finally, I'm just hoping that you get the seat this time. Best of luck, everybody. Any questions, please? And those who are yet to sign up, please sign up today. Because we are starting the first part, right? Also, the mock exam in Ireland, I have not announced the dates because I'm not very sure about the exam dates. Oman booking also, I'm just going to do as soon as the students are already there. Lots of students in the mock group. I think you're more than 60 already, but we are only going to announce the date as soon as the exam dates are there. All right. Thank you very much. Any questions, please? Amar, Javeria, somebody joined in the middle as well. Javeria, how are you? Good to have you here, my dear. Soni, Seema, when are you coming back? 18th, yeah?
Ma'am, I 18, yeah, ma'am, I'm coming 18, but I'm so worried that I'm not studying.
No,
You
no,
know,
7 days, absolutely okay. Please give time to family and enjoy yourself. It's okay. This breather is must in between. All right.
yeah,
Okay. Thank
inshallah,
you so
ma'am.
much. When
Thank
you
you
get
so
back,
much.
let me know. Javeria, thank you very
Inshallah,
much.
ma'am.
So good to see you, my dear. But you joined in the middle. Please listen to the recording, okay? All right. Thank you very much. Thank you. Any questions, please? Ali, I'm seeing your messages. I'll just let's have a phone call after this, yeah, regarding your booking, my dear. Thank you so much. Thank you. Any other thing from my side, please? Thank you very much. Have a lovely weekend, ladies and gentlemen. Thank you so much. I love you all. Take very good care. I'm going to see you in the study group. I hope the practice would be the way I want you to do. Iram, thank you so much for joining in. Best of luck from the entire team of RFA tutors. Love you all. Take very good care, Gada. So good to see you, my dear. You all are my energy. See you guys with the same enthusiasm, hoping that you all get the seat in one go and you're all appearing in exam. With all these prayers, with all these blessings, may all of you have the best of the results in May 2026. Best of luck from us. We stand besides you, Mehnaz, Gada. But the only thing I need is hard work and the focused understanding of the Osce. Let's make it a success together. Thank you so much. Thank you for joining in. Have a lovely weekend, everybody. Thank you so much. Bye-bye. Take care. Thank you so much.